5 Investigates first exposed the mental health crisis hitting our young people.
A crisis tied to the high-potency pot that's now available across Massachusetts.
Then I would just do it like pretty much all day.
I thought I lost my son.
Doctors told us too many families just don't know about the dangers. Now, new research confirms the threat is growing in Massachusetts.
Our Mike Bodette talked with one of the doctors leading the charge to raise awareness and protect our kids.
Do you think people understand the risks?
I don't think enough.
Dr. Cheryl Fu is talking about the negative impact of high THC cannabis on the developing brains of some young people. She sees it firsthand in her clinical work at Mass General Hospital.
Psychotic-like experiences, depression symptoms, anxiety symptoms, even suicidality as well.
And then I would do it like during school, then I would do it during work, then I would just do it like pretty much all day.
It's an issue 5 Investigates shined a spotlight on earlier this year. This teenager who used high-potency vape cartridges shared his story after suffering from cannabis-induced psychosis.
I just felt really, really weird. Like, I didn't even know what was going on.
I thought I lost my son. He wasn't present. It was just this person that was completely manic and talking like someone that you would expect to see on the street, like a homeless person that's talking to themselves and acting really crazy.
What doctors have been seeing for years is now being backed up by research in the American Journal of Preventive Medicine.
And what we found was really startling. We found this really significant increase in cannabis-related psychiatric emergency visits among teenagers.
The researchers examined health records from more than 7,000 people treated by Mass General's Psychiatric Emergency Service. They focused on those who tested positive for THC, comparing visits before recreational dispensaries opened to visits during the first year recreational marijuana was sold. The impact on young people was clear.
From 5% to nearly 20% of teenagers who had cannabis detected in their urine when they were coming in for a psychiatric emergency.
That's a 300% increase. Dr. Fu says researchers did not find such a dramatic jump in other age groups.
Cannabis commercialization, the increasing availability of cannabis and high-potency cannabis is disproportionately affecting a vulnerable subgroup of teenagers, of youths, particularly those who have mental health challenges.
But the Cannabis Control Commission, which regulates the industry, is questioning this Mass General study. They say there's no proof that legalization caused the increase in THC-positive young people seeking psychiatric help.
There were fewer than 40 recreational dispensaries open during the year the researchers focused on. Now there are close to 400.
I really suspect that the impacts are much greater.
Dr. Fu says more people need to be educated about high THC risks for teenagers, including parents, teachers, and even pediatricians. I'm Mike Bodette. 5 Investigates.
If you have a tip for 5 Investigates, give them a call, 781-433-4018, or you can send them an email, 5investigates@wcvb.com.